pockets first, right? Okay, so hi, Mrs. Brown, how are you today? I'm just checking to see if you've got any allergies. You're sounding a little congested. Just let me check your oxygen saturation. I'm just going to listen to your lungs, but I'm going to put your head up first. Magic hands here. And she would go right up into high Fowler's for suctioning. So
High Fowler's.
right up. And so I've got my stethoscope, I'm getting it to lean forward, I'm doing my lung assessment. Oh yeah, I do hear some crackles. I think your tracheostomy needs suctioning, so I'm going to do that now.
Sorry.
Okay. I'll get my equipment and I'll be right back. Okay. Now, of course, because I'm in with a trach patient, I'm going to have all my proper equipment on, my gloves on, and so I'm going to get my suction is over there, and I've got my suction tube attached. And I'm going to put that onto 80 to 120. So I turn that on to 80 to 120. I've got my suction catheter, and I've got my bowl, and I've got my sterile water for suctioning. So I'm just going to get this. It doesn't really have to be sterile, so opening it up. I just want to make sure on the inside it's sterile. So I'm just going to make sure. Open up, flip, pour. So this is where this will differ a little bit, so just keep in mind. So yours, you have one long suction tube. So you're just going to open up the package, and you're going to, this isn't going to get contaminated. At the end of this, you're going to put onto here, okay? So that's all ready to go, okay? So now it's still sterile on the inside, okay?
Bless you.
Thank you. So now I'm going to put on my sterile gloves. My gloves inside, so I can't. So now I've got my sterile gloves. Okay. I know there's a.
Okay, yeah, it's okay. So
Okay, I'll just pretend because as long as you guys know how to put on sterile gloves correctly, okay? All right. So I've got my oxygen on my patient. I also could use. Is there an ambu bag over there? Was there an ambu bag? Yeah. See that ambu bag? Just grab me that. So just so I can show you, just in case. So I'll have that ready to go, so I can show you either way. Keep my oxygen on. You want your patient oxygenated, not oxygenated as little as possible, right? Okay, so I'm going to start. So one hand is going to be clean and one hand is going to be sterile. So with my clean hand, I'm going to pull this out. My sterile hand, I'm going to grab this. I want this sterile. Whoops, I'm not going to whip that across the patient's face, of course. Sterile hand is going into the lung, so I don't want that contaminated, okay? So what I'm going to do is you can do a test. So just put it into the water, plus it lubricates it. So just suction, everybody know, I think, how to, so to press on that, just suction, and it's lubricating it, so that's great. Okay, Mrs. Brown, I am now going to put the suction into your tracheotomy, and it might be a little bit uncomfortable and might cause you to cough. Okay, no suctioning on the way down, only suctioning on the way up. I'm going to insert it. With these, you know how it is, so don't worry if it doesn't go down, because these aren't even in as properly as they should. So we're going to go down, remember from the PowerPoint?
You're holding it.
10 to...
Yes, yes. And how far?
10
to
12.
Yeah. Okay, so don't worry, I'm not going to worry about it if you can't get it in. So let's say it's 8 to 10 or 10 to 12. And then I'm going to apply the suctioning, twirling it around as I bring it out.
So do you apply the suctioning intermittently, or...
I just apply it consistently.
Okay.
As it comes out, okay? Oxygen and back on. Come here. Get rid of the mucousy stuff because it's going to be plugged, plus it relubricates it. Gives you a few seconds for some time to oxygenate again.
Every 20
Okay.
seconds.
I'm going to do this again. So insert it in. Right. A little bit closer. 10 to 12. On the way out, I'm rotating and bringing it out. Okay. And then I can also do this. But if you wanted to, what you can do, the other way of hyperoxygenating, I just wanted to show you, is with the ambu bag. And you just go. Okay. A little bit more awkward, so you don't have to do that. Okay. Lubricant. So you can either just pull the mask up, which most people prefer, or you can use ambu bag. But you can try it just for your own experience. Insert it in. suctioning and twirling on the way out. Okay. And then I can put my oxygen back on because I've done my 3 suctions. And then to get rid of this, remember how we had the gloves? And then we just pulled the gloves right
Oh,
over.
okay.
Okay, and then throw it in the garbage.
Okay.
And then we're gonna do our post-assessment, O2 set, listen to the lungs, make her comfortable. Okay? It's not too difficult, right?